Welcome back to Kannada Infotech YouTube channel. Today I am going to discuss with the most important questions for the recruitment of staff nurse. The previous question paper with solved answers. Question number 1 is, what is the term for a device used to take the place of a missing body part? Option D, prosthesis. Question number 2, when a client has left-sided weakness, what part of sweater is put on the first? Option B, left sleeve. Question number 3, it is appropriate for a nurse aide to share the information regarding a client's status with option D, the staff on the next shift. Question number 4, when helping a client who is recovering from a stroke to walk, the nurse aide should assist option B, on the client's weak side. Question number 5, the nurse aide is caring for a client who is agitated, the nurse aide should option C, talk in a slow, calm and reassuring manner. Question number 6, the purpose of padding side rails on the client's bed is to protect the clients from injury. Question number 7, exercise that move each muscles and joints are called range of motion. Question number 8, how can the nurse aide best help a client who is not accepting a loss? Option C, encourage the client to talk. Question number 9, the Heimlich maneuver is used for a client who has a blocked airway. Question number 10, to best communicate with a client who is totally deaf, the nurse aide should write out information. The question number 11, the nurse aide is asked by a confused client what day it is. The nurse aide should point to the date on a calendar and say the date. Question number 12, to avoid pulling the catheter when they turn a male client, the catheter tube must be taped to the client's option B, upper thigh. Question number 13, a nurse aide can assist clients with their spiritual needs by allowing clients to talk about their belief. Question number 14, a nurse aide must wear gloves when? Option B, doing pericare. Question number 15, when getting ready to dress a client, the nurse aide should option B, give the clients a choice of what to wear. Question number 16, if the nurse aide discovers fires in a client's room, the first thing do is option D, remove the client. Question number 17, in order to communicate clearly with the client who has hearing loss, the nurse aide should option D, look directly at the client when speaking. Question number 18, which of the following stages of dying is usually the final stage? Option B, acceptance. Question number 19, if a client says, God is punishing me or why me? How should the nurse aide respond? Option B, listen quietly. Question number 20, the role of the ombudsman is to option B, work with a nursing home to protect clients' rights. Question number 21, a nurse aide who is active in her church is assigned to care for a client who is not a member of any religious group. The nurse aide should option C, respect the client's beliefs and avoid starting religious discussions. Question number 22, the nurse aide notices that a client's mail has been delivered to the client's room. The nurse aide should do option D, give the clients the unopened mail, offer help as needed. Question number 23, which of the following is correct measurement of urinary output? Option B, 300 cc. Question number 24, the client offers a nurse aide to $20 bill as a thank you for all that the nurse aide has done. The nurse aide should do option B, politely refuse the money. Question number 26, if a client is sitting in a chair in his room masturbating, the nurse aide should do option D, leave the client alone and provide privacy. Question number 27, to convert a 4 ounce of juice to milliliters, the nurse aide should multiple option D, 4 into 30 ml. Question number 28, in giving care according to the client's bill of rights, the nurse aide should do option A, provide privacy during the client's personal care. Question number 29th, the last sense a dying client will lose is the hearing. Question number 30. A client wakes up during the night and asks for something to eat. The nurse aide should do Option A. Check client's diet before offering the nourishment. Question number 31. The normal aging process is best defined as the time when the normal body of function and senses decline. Question number 32. If a client is confused, the nurse aide should do help the client to recognize familiar things and peoples. Question number 33. What is the process of restoring a disabled client to the highest level of functioning possible? Option C. Rehabilitation. Question number 34. When changing an unsterile dressing, the nursing aide should wash hands. Option D. Before after removal of soiled dressing and after the procedure. Question number 36. The nurse aide finds a conscious client lying on the bathroom floor. Option B. Call for assistance from the nurse in charge. Question number 37. If a nurse aide finds a client who is sad and crying, the nurse aide should do ask the client if something is wrong. Question number 38. Clients have the rights to option B. Have access to a telephone. Question number 39. Proper use of waist restraint requires that the nurse aide option B. Watch for skin irritation. Question number 40. To prevent the spread of infection, how should the nurse aide handle the soiled linens removed from a client's bed? Option D. Put them in a dirty linen container. Please like the video and share the video. We will come back with more questions with answer. Thank you for watching.